After 18 long months of waiting, it looks like we're mere weeks away from younger school-age kids getting access to COVID vaccines. Pfizer announced this morning that they found their shot to be safe and highly effective in kids 5 to 11 years old. Soon they'll be handing over that data to the FDA to get their sign-off for emergency use authorization. If all goes well, kids could be getting their first shots by Halloween. And not a moment too soon, with more children getting infected by the Delta variant of COVID and more going to the hospital as a result. As for the rest of us, the confusion around booster shots only seems to be growing. Last month, Joe Biden announced his administration's plan to give just about everyone access to a third Moderna or Pfizer shot 8 months after their second. The quiet caveat was that it was pending FDA approval, which no one really paid attention to until Friday, when the FDA Advisory Committee shot down the plan to offer the extra shot to everyone, at least for now.
We were uncomfortable, actually, following essentially Israel's lead, which was to make this a 3-dose vaccine for everybody over 16 years of age. We didn't think there was enough data to support that. We wanted to test the water with 1 foot, really.
So for the time being, only people 65 and over and those at high risk of developing severe COVID, and only if your first shots were made by Pfizer. But let's not forget, more than a quarter of people eligible for the vaccine still haven't even gotten a single shot. And as we've said time and again, it's the unvaccinated who make up the vast majority of rising COVID deaths in this country. Over the weekend, a sea of white flags went up across the National Mall, stretching acres, symbolizing every person who's died of COVID so far. And just today, we surpassed the final death toll of the 1918 Spanish flu pandemic. 675,000 mothers, fathers, sisters, brothers, sons, daughters, friends, neighbors. And now, the fallout is extending beyond COVID patients, as several states are moving toward rationing care for everyone, meaning hospitals dealing with equipment and staff shortages because of the COVID surge could opt to deny potentially life-saving treatment to any patient if they think the odds of someone else benefiting are greater. Yet while we correctly bemoan the fact that only 55% of our fellow Americans are fully vaccinated, we ignore the fact that in, say, Africa, fewer than 4% can make the same claim. I'm joined now by Dr. Vanessa Kerry. She's director of the Global Public Policy and Social Change Program at Harvard Medical School and a physician at Mass General Hospital and CEO of the nonprofit Seed Global Health. Dr. Kerry, it's good to see you as always.
It's good to see you too, and I feel like I need to add mama too as I hear my little people in the background.
I'm glad you did. So while much of America is complaining that the approval of the boosters is not happening fast enough, some of us read a piece by the guy who is in charge of Africa for the WHO in the New York Times over the weekend, saying, and I just wrote this down, it's like giving a generous education grant to a billionaire while others are scraping to make tuition. Obviously, he's saying don't do the boosters at all in the U.S. Who's right?
I think this is the complexity of it, right? I think that right now we do not have enough data to support giving a third shot to healthy Americans who have completed their full dose and who, for every reason we know and the data has shown, you have a strong enough reaction to prevent hospitalization and death. And that is really critical. You can, you will do well. You will not die from COVID, and yet, when we do need to be thinking about what it means to provide protection for those at risk around the world, and to really shut down the transmission of this pandemic and the virus that is causing this pandemic globally. So the reality is that these variants that we worry about, they erupt in places where there's high transmission and where there's very low vaccination rates. And that is actually our greatest danger right now from COVID at this point, is that we're going to get a variant that's going to escape all the hard work we've done to get vaccines rolled out. So from a moral standpoint, it does not make sense to protect people who are well protected against COVID when we have a huge number of people around the world in desperate need of a vaccine.
I agree with the moral, if I may, I agree with the moral argument, Doctor, but as a practical viewpoint, we threw out 13 million doses of the vaccine in the U.S. over the summer. Every dose that I don't take here does not mean that we'll provide a dose for that individual in Africa, does it?
It could, though, truthfully. If we really thought about, looked at the utilization rate of vaccines in this country and anticipated what our needs were, we could be doing a better job of making vaccines accessible, I think, globally. And planning better to think about production rates and distribution rates globally. And I think that so there's an opportunity here to refine that going forward in a way that we aren't throwing out those vaccines, because just because we say that the vaccine's available here doesn't necessarily translate to an appropriate use of a COVID booster here, because we don't have enough data to know how you do with a third dose on a massive scale, right? We have very small studies that are kind of supporting some data. So this is why it gets complicated fast. But the reality is we do know that there are billions of people around the world who need vaccines. We know that you are well protected with a 2-vaccine regimen against hospitalization and death. And we know that there's also an economic argument beyond the moral argument that says that high-income countries, us, the United States, will actually financially and economically be in a better off position if we are vaccinating the world. If you want to not even worry about the moral, because it turns out that all of our raw materials, most of our manufacturing for our economy is happening in those places right now that are not protected. So if you can't get behind the moral argument, you should be able to get behind the economic argument.
Well, on the moral argument, just as an aside for a second, I can't resist that, I assume people know the WHO is an agency of the United Nations, the same United Nations who is allowing the homicidal, unvaccinated president of Brazil to address the General Assembly. And so maybe stopping that would be a good move, too. Let's come back to the United States, if we can, for a minute. Roughly 2,000 deaths a day over the weekend. I think it's the highest number since March. 30% of those, not surprisingly, in Florida and Texas. I mentioned at the top, there is rationing being discussed in places like Alaska, Idaho, Montana, Hawaii. Is this just a phase, or is this what we have to look forward to as we get into the fall and winter, Doctor?
I think, unfortunately, with the fall and the winter, as people start to go indoors, I think as people get fatigued from this, and I think, unfortunately, as kind of the politicization of the pandemic continues to be fueled, I'm afraid we're still going to be looking at higher numbers. It's hard to know. We don't actually totally know the number of people who maybe have been infected and haven't reported it. So we don't know what degree of herd immunity in full that there may be at this point. And at some point that might kick in to help reduce numbers. But the reality is our healthcare system is completely stressed in places where people have the opportunity to take a vaccine that saves lives. Healthcare workers are exhausted. They are at risk. And we have health systems that are not able to care for all of those that are sick. And so the hard part is for those people who are refusing something to protect them, they may be in those situations where they're going to be denied care if we keep stressing the system in the way that we are.
Speaking of stressing the system, when you treat a patient in a bed of yours who is unvaccinated, and that's the reason why he or she is there, is it hard to generate compassion for that individual?
As a physician at Mass General, I have taken care of patients who have come in unvaccinated. This summer, I had a couple really heartbreaking cases of very young people who chose not to vaccinate, and they were in my ICU, intubated, and incredibly sick. And I think that as a job, my job as a physician is to care for a patient regardless of why they come in or the choices they make. It's hard. I'm going to be really honest. It is hard to see patients be sick. You still have compassion because people are suffering. And I think in those moments, they realize they wish they'd made another choice, right? And I think that all we can do is try to help them then go forth to help everybody else in their community make that different choice, right? And so I've tried to hang on to that compassion. I think it's understandable, though, after a point when you are, I think watching my colleagues be as fatigued as they are, I think everybody is doing the best they can to cope with what has been an extraordinary year. And we have not done enough to protect our healthcare workers. We have not done enough to invest in them. Globally, 115,000 healthcare workers at a very low estimate have died. We need PPE. They need vaccines. We need to be expanding the numbers. We need to be supporting them. This is a really big systemic problem. But it is very difficult to see something that is so preventable continue to play out day after day after day.
I only have 45 seconds left, but speaking of protecting your colleagues, protecting kids for our last 45 seconds, if a kid was in close contact early on, quarantine. There's now something called Test to Stay. 2,000 schools in Massachusetts are doing it. You're a close contact. If you have no symptoms and you regularly test negatively and you wear a mask, stay in school. Is that the right path? Quickly, if you can.
I think masks work. I think if you are able to test and you test frequently, so daily, to be able to know if people are, infectious, I think it's a reasonable way to keep kids in class and learning. We should be scaling up testing across the board to keep populations and people safe. If we had a robust testing system in this country, we could be preventing the spread of COVID immensely. We have never made that kind of investment, but masks absolutely work. And so the key is masks, hand washing, frequent testing, I think is going to be a path forward for us to be able to manage and to keep our kids in school.
Let me add one adjective to that list. Free testing wouldn't be a bad idea either.
Thank you. Excellent point. No, we need to make it affordable and free. Right now, tests over the counter are $20. That's out of reach for most.
Dr. Vanessa Kerry, thanks for your work and thanks for your time as always. It's good to see you.
Thanks for having me on.